obviously the
Sorry.
most insane barometer of illness that you can imagine in a group of older people who have a lot more to worry about and really just want to go on with their lives just like the rest of us do. And they're not allowed to. They have to be prisoners to this false number, this transmission rate, which is usually the transmission rate is what it was 3 weeks ago, is what we're hearing about now. So yeah, it's been a crazy world. When the president announced on 60 Minutes
Yeah.
that the pandemic is over, it's like, yeah, it's been over for a year. I mean, because it's been over for more than a year. The pandemic is, by definition, is a worldwide infectious disease outbreak that is more significant than a typical outbreak. So every year flu and other infections will kill and hospitalize, hundreds of thousands, if not millions of people every year. And that's not on the news. And we are, with COVID, the last year and a half have been kind of at those levels. What we have previously considered acceptable and not newsworthy, and certainly not excuses to have the government and public health clamp down on our lives to the degree they have. So he honestly said, "Look, we're back to normal," and all the doctors said, "What do you mean? People are in the hospital. People are getting sick." Well, yeah, always, right?
Right.
I mean, that's always.
The hospitals
So,
never, right? Never.
I mean, there's always going on, but the question is it severe enough, or does it warrant us to shut things down, to infringe directly upon people's lives, to actually potentially cause more harm than we are preventing? And I am not one to quote Donald Trump, who I do not like
Yeah.
personally,
It's just,
but one
disclaimer. We call that a disclaimer. Go ahead.
Disclaimer. He had two wise things to say at the beginning of this pandemic. They were absolutely accurate. Number one was, just because there are car accidents doesn't mean we shut down the roads. And number two, he said, if it were up to the doctors, we'd be shutting down this country every day forever. And that's true. I work and live in the medical system, and the whole medical system is fueled by scaring people. We scare people into thinking they're sick. We build up diagnoses. We then say, you don't get this treatment, you're going to die. And that view, which propels the medical system, which doctors learn in medical school. Doctors are actually picked to go to medical school based on standardized testing. One right answer is what they're taught. One right answer. And I say that having gone through medical school and also having two kids who have. I see the way it is. So that's the doctor mentality, and that's the way they're treating COVID. Is, wait a minute, there's still cases. There's still cases, so everyone has to still be on guard. But again, millions of people are get sick from flu every year, and that's just the tip of the iceberg. I've seen more people with Lyme disease recently who have had severe illness. So yeah, but when you put it on CNN and interview people who have been hurt by it and start putting up statistics, it looks scary. But again, we have to distinguish between what's normal, what has been acceptable historically, and what is not acceptable. What was not acceptable was that first wave of COVID that came in the spring of 2020. We were scared, so we resorted to all sorts of,
I guess, understandably scared, right?
Right. I mean, the goal at that point, the stated goal by Fauci and everyone else, was we just have to clamp down in case our hospitals get overcrowded. That was the goal. Now the goal is, if there's any cases, we have to shut down. It's really morphed to be, now if there are even cases of this Omicron, which is seriously less deadly than most flu strains that we just accept every year, then we have to shut down again. And in assisted living, long-term care, a lot of places now in the healthcare industry, my daughter is going to have she goes to medical school, and she's going to have what's called a white coat ceremony, where you go there and you celebrate the beginning of medical school. And they said, absolutely everyone who's going to be in this has to wear masks. And it's like, why? This is supposed to be, these are the people who teach medical students and are the bastion of medical science. They're all going to have you wear masks, and then they're going to walk outside and not wear masks and go to restaurants and not wear, it's like this
counterintuitive,
this madness. It's just show. It's just for show. And I think it shows. I think doctors have used this to really scare people and to want them to be treated and to be, the treatments for COVID that are being touted are dangerous. I could tell you a story of one.
Please.
If you
yeah.
You want to hear a quick story? So there's a drug called Paxlovid, which is an antiviral. I think it's sold by Pfizer, and everyone's got to be on it now, even though we have good treatment for COVID that is cheap. And even though most COVID these days doesn't even need treatment. But Paxlovid, there was an experimental, emergency use authorization study which showed that it might help, but it had massive interactions. So that the study that the company did eliminated anyone who was on any drugs at all, and eliminated anyone who had been vaccinated. So they had a very small group of people. It was done during a surge of Delta, and there was a very small number of people who survived who took this drug based on those criteria. Very few. So then Israel did another study, and the big headlines were Paxlovid drops the death rate by 80%, drops hospitalization by 75%. Now, anyone who's heard me talk knows that once you start talking percentages, there could be problems, because 80% of what, right? So so one of my patients who got COVID, the son put her on Paxlovid, and this son is a doctor who's an expert in infectious disease and COVID. He actually helps hospitals develop COVID policy. So he says to me, well, that Israeli study is absolutely compelling, and you can't argue with it. Well, I looked at the damn study, and so I looked at the numbers. Number one, it looked backwards at people. So it wasn't a study that says, okay, we're going to give half the people Paxlovid and half some placebo and see how they do. No, it looked back and said, okay, of a couple, 100,000 people with COVID, we'll look at the people who got Paxlovid and the ones who didn't, see who died. Well, when I looked at the numbers, the 80% reduction in death rate was 4 out of 1,000 people. And that 75% reduction in hospitalization was 2 out of 10,000 people. But not only that, the people who were who did not get Paxlovid, a lot of them didn't get Paxlovid because of the drug interactions. So they were the sickest people. They're the people with bad heart disease and bad diabetes and atrial fibrillation who couldn't get Paxlovid because it interacts with all their medicines. So now you're taking two groups of people, the Paxlovid group with all the sick people in it. The Paxlovid group with all the well people in it, and the non-Paxlovid group with all the sick people in it, and you're comparing them, and you come up with 4 out of 1,000 people benefited. Well, if you actually randomized the trial and had the same number of sick people in both groups, we all know what the results will be. Paxlovid not only will not work, but it could end up killing people like previous antivirals. But here is this doctor who's an expert in this field who doesn't even understand that. I'm a schmuck. I don't try to, I'm just a regular doctor. I just have a bit of common sense. And I know that you can't believe what the studies say. You got to look at the numbers. There's not a study that comes out. I don't look at the numbers. It takes me 5 minutes to look at the numbers, and anyone could do it. This could be a 4th grade exercise, and they will be able to figure this out. But doctors don't. Doctors believe in all the horror that's being, put by medical organizations. They don't know how to read studies. They are doom and gloom people, because that's the business model of the medical system, and that is also how they're trained. And they're not trained to have common sense, to ask questions, to question studies. They're trained to follow orders. And sadly, that's what Curing Medication is about. That's what all my writings about the healthcare system are about. And COVID is all that on steroids. And unfortunately, no, the doctors will never let this go away. The public health department will never let this go away. They're loving every bit of it because it scares people to death, and it makes them better for all the drugs and treatments and visits and hospitalizations that really pay a lot of big
A lot of money.
players.
Yeah. When
Yeah,
Dr. I'm sorry.
bad.
Go ahead. Yeah.
Go ahead.
I'm talking with Dr. Andy Lazris. It's andylazris.com. Listen to some of the music, by the way. It's incredible because you write fiction, nonfiction, music, and even through COVID, you kept pouring it out. You blow my mind. But a couple of things I want to say. When you say that about studies, Dr. Lazarus, one of the things, and again, you say, you're not a schmuck. You are an educated, experienced physician. I'm the schmuck. But I've learned years ago when I'm looking at a study, and so too frequently I read way over my head, and I've got to look words up, et cetera, et cetera. But I'm interested. And I learned years ago, okay, how many people, how long was the study, et cetera, who were the participants? Because there's so many out there that it's like, I'm thinking, for 6 months, you've 500 people. I question those also.
Questions. You have to look at how many people. You have to ask which people. You have to ask what are the two different groups. So I'll give you an example. Like there were some early studies that proved masks work by comparing areas of the country that wore them and areas of the country that didn't wear them. I looked at one of these studies. The group of people that wore masks were a bunch of young, healthy, pretty well-off people. And the group of people they compared it to were in a rural area, not well off. Their healthcare was bad, and they were far older. So they say, look, the mask group did better than non-mask group. Yeah, but what about all the other variables you failed to consider in terms of how healthy the people were, how old the people were, and what their underlying health conditions were? They don't consider. And so a doctor should, right? You say, I'm a trained doctor. Well, the training we get is just to look at the study and believe it. So that, we're trained to be little sheep. Any doctor who's reasonable should never take a study on face value. They should open the study and look at the numbers. Then there are two numbers. All you got to do is look at two numbers. What are the actual numbers of people who benefited and were harmed in both groups? And then the other one is, what were the exclusion? What were the variables that they used to compare the groups? Did they take all variables into account when they looked at these two groups? That's what we call randomized. Were these results randomized? So group one and group two look the same in the important ways. Like the Paxlovid study I told you, obviously they didn't. In this mask study I told you, they were completely different. So it wasn't the mask that had anything to do with it. Is you had a sick group and a healthy group, and obviously the sick group's going to do worse whether they wear masks or not. But these studies are designed to trick you. But the doctors should be the ones who say, hey, wait a minute, beware of the study. Instead, they endorse it because, again, this is how they're trained. They're trained to just follow orders. And yeah, it is not just COVID. It's the whole healthcare system. Why are we spending, $4 trillion and have one of the worst outcomes in the world? Anyone with a brain and common sense would have to ask that question. Why are we doing worse than Bolivia in health outcomes? It's scary because bottom line is, obviously we're healthier than people in Bolivia, baseline. We have more resources, we have more money. So the conclusion you reach, and which I've reached after a lot of research, is the reason we're doing badly is because of the healthcare system. They're actually making us sicker. And there's ample evidence of that. The areas of the country with the most specialists are the areas of the country where people do worse. There was a funny study in a New England Journal years ago. It looked at the amount of heart attack deaths during the week when all the cardiologists went away to a convention, and that week had the lowest heart attack deaths of the whole year. So and the
hard to imagine.
That's just coincidental, but yeah, that may have been. But every bit of the healthcare system shows us that when doctors get involved, your outcome's going to be worse. And that's
Wow,
scary.
that is scary. I'm talking
And
with
so
Dr. Andy
welcome,
Lazris.
welcome to COVID. Now, welcome to COVID. We have the worst outcomes in the entire world. The country that has the best outcomes in the whole world, the one with actually their length of life actually improved, and they have the lowest excess mortality in the world, is Sweden. And if we remember about Sweden, their doctors said, look, we're not going to wear masks. We're not going to shut down society. Those are all more dangerous than COVID itself. You can't stop a respiratory virus. It's going to spread. That's just the way respiratory viruses act. We're going to let the kids go to school. We're going to not scare everyone. And voila, they did better than anybody. And even today, the doctors in our country are saying, well, Sweden, we don't want to be like Sweden. Yeah, I guess we don't. They're living longer than us by a long shot. So God, we don't want to be like them. They're too healthy, and if you're too healthy, you're not going to feed into the medical system. So
that part is again, that's, I was going to say disturbing. It's frightening. A couple of quick comments. Again, I'm talking with Dr. Andy Lazris, andylazris.com. A couple of things with, of course, what you mentioned, Fauci, and again, I think I've had folks on from White Coat Waste Project many times over the last couple of years that have exposed some of the horrific experiments that are taxpayer funded and come up with no results. And that's again, the economics of it. I mean, great. So you get millions of dollars to do research that is ineffective. That part bothers me. The other thing, when we think about some of the economics, Dr. Lazris, and again, I say this with empathy for obese people. I've had my struggles. They haven't been that, but we've all had struggles, and yet it seems to be. And then add that to the rates of diabetes, and if there's something that is troubling in America, is the amount of diabetes. Again, it's look at the drug companies. We always follow the money. And again, I'm not the vaccines. I can't judge that, but when I think about the diabetes and I think about all the ads, and I may have said this to you before, I'm not diabetic. There's no one close to me, certainly no one that I know that's diabetic, yet I know what A1C is. How do I know that? From the advertising. And it's like, okay, we're going to do this. And then we've got this. Now we've got this thing that you don't have to stick your finger. Now you just put it on your arm and monitor. And I'm thinking of the billions of dollars, and where is the government trying to help get people to reduce the rates of diabetes, as opposed to, we'll just medicate them and what I call kicker drugs. And if it's not working well enough, we've got a kicker drug and then I see all the ads for that. And it's just, that part is, again, I have great respect for pharmaceutical companies that are doing wonderful work and important work and life-saving work. It's the other part that is disturbing to me.
Yeah, and I don't know that too many pharmaceutical companies are doing all that good work that you mentioned. I mean, frankly, most of the people that come up with really innovative drugs are very small companies that the big pharmaceutical companies buy up. They're busy making what we call copycat drugs, which is, this drug works. Let's make a drug that looks like this, and we'll try to sell it and pretend it's better. That's where the vast majority of pharmaceutical revenue goes into three things: the development of copycat drugs, their legal war chest. I mean, the blood thinners out there, which the cardiologists say you must take or you'll die. Most of the drug companies keep at least $500 billion annually in their legal war chest to deal with the lawsuits that come from all the people who die from these drugs. And then the third is advertising. And advertising is not just what you see on TV. It's the money they give to doctors, the money they give to Congress people. But the biggest bang for their buck are the money they give to medical organizations like the Alzheimer's Association, American Diabetes Association, American Cancer Society. Those get the vast majority of their money from drug companies, as does the CDC and the FDA. Those are primarily funded And the CDC has a funny line. We don't get money from drug companies, but they get they get most of their money from the CDC Foundation, which gets all of its money from drug. And a
so
lot of, like, from Harvard will say we're not paid by the drug companies, but the drug companies are paying Harvard, and then they pay the doctor. It's a trick, but so the drug companies aren't doing anything wonderful. And when you watch these diabetes commercials, what's the A1C you're supposed to get below? And they all say we get your A1C below 7. Well, an A1C below 7 is frankly dangerous, and especially in people who are older. That will cause them increased rate of stroke, heart attack, falls, confusion, fatigue. So we pounded in our head that you're supposed to get your A1C below 7. The doctors just buy this because they watch the same TV you do, and that's their source of education. And yet, an A1C below 7 is dangerous. So when I was going to say, the diabetic epidemic is based on two things. It's based on the amount of obesity we have in this country, which is also triggered by how doctors have defined what we should eat. Because, and I have this in my book that's coming out, but low-fat diets don't work.
Yeah.
And yet they cause diabetes. So because we eat more sugar. But that's
forgive me for interrupting you. Forgive me for interrupting you, Dr. Lazris. But that one of the things that I remember. And again, I eat a very healthy diet. I've been vegetarian for 52 years, vegan for the last couple of decades. But again, not mostly the products. I like to cook. Anyhow.
Yeah.
I eat lots of beans, lots of a healthy diet. When I think about some of the things that you're saying, I remember the low fat and the craze, and I'm trying to remember the brand of like cookies that came out. What was it? Snackwells, yeah. And I remember talking with someone about it, and I'm looking at the pack at home, and I'm looking at the package. I said, "Do you see how much sugar's in this?"
Exactly.
I mean, it was, and fats are, again, I'm not a nutritionist, I'm not a physician. Fats are important for us. I'm reading article after article how good it is to eat avocados, for example, and the good fats. There's good fats and there's bad fats.
Oils, and even the bad fats aren't that bad. They're certainly better for you than sugar. But that's what we did. And when you talk about, I'm not a physician, do you know how much nutrition that the doctors get in medical school and residency?
Training? No.
Zero. They get zero.
Yeah.
The only nutrition they get is they will get a couple weeks where they learn the chemical structures of various supplements. But the doctors are not trained or even taught the importance of nutrition. They're taught, that you're supposed to give drugs. Or you say, if you go to a doctor, you'll hear, well, watch your diet and exercise more. That's how much, that's their extent.
Pill, right?
But they take this pill. So the second cause of diabetes, other than the fact we're all obese now, is they've changed what the definition of diabetes is. So half the diabetics in this country would not have been diabetics 25 years ago based on the number of what they define as diabetes. So when we keep enlarging the scope, we've done this with blood pressure, we've done this with kidney disease, we've done it with weight even. If we enlarge the scope of what abnormal is, we keep increasing the definition of abnormal, all of a sudden people get diabetes. I remember one study, the SPRINT study, which changed the blood pressure normal, created 100 million new people with the diagnosis of high blood pressure overnight, just by changing the definition. So half the diabetics in this country are not actually diabetic. They've invented something called prediabetes, which doesn't actually exist. No one with prediabetes is more likely to get diabetes than people without prediabetes. And all these things require medication, because guess what? Nobody talks about diet. Have you ever heard Great Fauci talk about, if you want to do well with COVID, best to lose some weight, eat well, a lot of fiber, eat some vitamins, do some have you ever heard him say that? No. And public health people, have they ever said that? They don't. They say, isolate, wear a mask, and take my drugs, and that's what they take.
Dr. Lazris, I know you got to go in a couple of minutes, and I want to continue because I wanted to revisit one of your books. I mean, I don't want to pick one out as a favorite, but January 6th and the Millennial Horde, we've got to get you back to talk more about it. I know we talked about it before, but when I think about the money, and you talked about and there's money, so they don't, it makes me think of glyphosate, which is sold as Roundup in most cases. All the successful lawsuits against the company, now it's Bayer, it used to be Monsanto, that has made this, all the successful lawsuits linking that to a variety of illnesses. Why is it still on the market? There's a lot of money in it. So they are obviously making a fortune, enough to pay out these tremendous lawsuits. But where's somebody stepping in, government, and saying, can't make that anymore. It's too deadly. It's too dangerous.
Well, they've clearly spread out their money too. So they're like the drug companies. They have a big war chest to deal with lawsuits, and they have a big war chest to pay off Congress people, and that, you know, they just know how to deal. I always joke with my Republican friends and say, how come other than like Rand Paul, I don't see any Republicans fighting this whole, you know, that all these immunizations and this, you know, the forced immunizations and trying to get rid of Fauci. They give like lip service to it because they're paid by Pfizer too. You know, they're on the same. Pfizer is not at all partisan. They give money out freely to anyone. And so, like I said, the drug company that makes Eliquis, the blood thinner. Now the doctors tell you that you'll get a stroke if you're not on Eliquis, if you have certain heart rhythm, but that's not true. I've written many articles on that. But they are happy to keep close to $1 billion in their legal war chest annually because they're making $10 billion a year on the drug. So it's a good trade-off. Monsanto's was very smart to fall under the Bayer. The Bayer's now their boss because Bayer sounds like they're healthy, right? They make Bayer aspirin. They make good, yeah. Right? So now how bad can Monsanto's be? And they will tell you all that, you know, the GMOs are saving people in the world. And you know, the GMOs, which are genetically modified organisms, so you're modifying plants so they are resistant to Roundup. Right. So,
which is scary to me.
Anything that's GMO means it's been sprayed by Roundup. Now, I don't care what the studies are. You got to know that Roundup, which kills everything, is not good for us, right? I mean, no one's, even the Monsanto's people are not going to drink a spoonful of Roundup and say, "Oh, this is okay." So we know that, right? Again, common sense has to prevail, and so why is no one talking about this? Yeah. Because they're getting paid.
Yeah, too much money in it. You know, we've got to do it again. I know you've got to split, but I do want to talk about some of your books and continue. And I've got a lot of email questions and comments. I'll just say it like that. A lot of comments about you. So let's do it again.
All I can say is, a lot of people who are not in the middle of it like I am and who haven't looked at the studies like I have are quick to believe what they're told on TV. And just be wary. The whole medical system wants you to be that way and wants you to think they're saving your life. But why are we doing worse than every other country? So you got to ask that question, and you can't say because
there's obviously good, thoughtful doctors out there. They're doing the right thing, like yourself.
There are a few.
And you're one of them, Dr. Andy Lazris. Thank you so much for doing the gig with me again.
Oh, it's great being here. Thanks.
You are so courageous. When you take intelligence and courage and put them together, it blows me away.
Sense, Lou. That's
say it again. It's what?
It's just common sense. That's what's lacking, in most people. But a little of that goes a long way.
Oh, sure does. Thank you so much. It's AndyLazris.com. I just love this guy. Andy, I hope I didn't keep you too long.